When Corey McKee was just 17, he joined the National Guard.
It was right after 9/11, and I wanted to go as soon as possible.
Soon, he left for Iraq.
We got hit by a suicide bomber March 25th, 2005. And that was a pretty bad day.
He was one of the lucky ones, walking away without any injuries, but came home with PTSD, vertigo, and tinnitus. That was just the beginning. A few years later, he set up a bonfire in his backyard.
When I started to stand up, I got really flush, and my tinnitus was ringing, and I just fell face first into the fire.
The fire burned most of his body. Corey lost his eye and his right arm.
And that is a trauma that surpasses anything I could ever imagine.
Doctors prescribed him pills to help with the trauma and the depression.
I've tried so many nerve medicines, and they don't work.
Then his doctor recommended ketamine.
It's ketamine? Yeah, it's ketamine.
Good morning, Corey.
Hey.
Good to see you.
Ketamine, designed as an anesthetic, but most people know it as the party drug called Special K. Ketamine clinics are popping up all over the country, stirring up controversy, but also hope as a way to battle mental disease.
This is an extra option. If you've ran out of other options, this is helping to treat treatment-resistant conditions.
Nurse anesthetists Katie Walker and Jen Holtz left their jobs at a local hospital to open Revitalist. It's the first ketamine clinic in Tennessee and the only one in the Knoxville area.
We're seeing such huge transformations in these patients and reducing symptoms of depression, anxiety, PTSD, restless leg syndrome, diabetic neuropathy, things like that we're treating.
Patients get a low dose of ketamine through an IV. Holtz and Walker say it's not addictive the way they prescribe it. And to prevent abuse, patients don't go home with any drugs. Everything is done on site.
Patients go to a mild to moderate dissociative state. That's how we know that the ketamine is working on the receptors that we want them to work at.
It's giving hope to patients like Corey, who's had a few weeks of treatment. His sessions are getting further and further apart.
With my physical pain, it goes away while you're doing the treatment, but after the treatment is when you notice the mental benefits of it.
He says it's helped ease his depression, PTSD, and phantom limb pain, and he's also off of all his other medication.
It could change so many lives. It's changed mine.
In Knoxville, Brittany Tarwater, WVLT News.